Right, thank you for tuning in for another video today. Look at today's video is on the top 5 causes of ankle pain. I think you'll find this very useful. We're going to go through the areas of pain, particularly around the ankle, and then name the medical names to do with them. As always, please don't treat yourself with these videos. See a doctor if you're having symptoms around the ankle and get a diagnosis. Now, the first one we're going to talk about today is something called tibial posterior dysfunction. It occurs due to pain on the big toe side of the ankle, so that's how it's going to present. And basically, it's painful in that blue area there on the picture on the right there. Pain all the way from the back of the ankle through into the arch. As I said before, its name is tibial posterior dysfunction. The pain extends into the arch, down into the foot, and it's often associated with a flat foot, although not in all patients. So there's a good diagram there of a flat foot. That patient there's got no arch at all. Now it occurs in patients that have either had flat feet all their life or they've had pretty normal feet but they find themselves getting flatter. And it's most common in middle-aged women or older, although it can occur in men. And that pain pattern is very characteristic, as you saw in the previous photo. Now, why does it happen? Well, the honest truth is we don't really know. Okay, people have got a lot of theories, but we don't know exactly what happens to people. We think it's due to the blood supply to the tendon, but as to why it occurs in some women and other women it doesn't, we don't know. What happens is that tendon that's in yellow there, which is attached to the muscle in the red, it's called the tibialis posterior. It's designed to hold your arch up, and it stops working for whatever reason. And that unfortunately causes pain and causes a change in shape in the foot over time. Now, treatment for it generally starts with orthotics, with the aim to relieve the arch, give you a bit more of an arch with the orthotic, and take some strain off the tendon. Failing that, you're generally looking at something like corrective surgery to change the shape of the foot, give yourself back an arch, use some tendons to do the job of the one that's not working. As I said before, it's called tibialis posterior dysfunction, so look it up. But it can be a very debilitating problem, and it's more common than it seems. Now, the second one is something called anterior impingement. So that's pain at the front of the ankle. So anterior impingement is the name of it, basically means scar or bone at the front. It's usually due to a bone spur called an osteophyte or scar tissue, and it's worse with ankle dorsiflexion, meaning bending the ankle back towards the knee. That's the action, and that's a picture of it there. The spurs there in red, and you get pain at the front there as the ankle's bent back. And generally that pain is increased really as it really is forced back towards the knee, as is indicated by the arrow right there. Now, this is just a drawing of our ankle from the front with the bones that make up the ankle, and we're just going to use this diagram to give you an idea of what the ankle looks like from the front in terms of its bony architecture, and then we're actually going to draw the ankle from the side so we can give you a bit of a look at how what happens when you get this anterior impingement syndrome, because it occurs in about 60% of soccer players and a lot of sportsmen and women. Now, this diagram on the right here, we're just drawing the tibia, the shin bone. There we've drawn the talus, which is the other bone that makes up your ankle, and this is looking at, once again, from the side view of your ankle. The heel bone, we're just going to label down the bottom there, its other name is called the calcaneus, and we're just going to mark the actual ankle joint there in red. So that's what your ankle looks like from the side in terms of what its bones look like, and this is important to help you understand what happens in this bony impingement. So we're just going to draw that ankle diagram from the side again, and that red arrow area is the bony spur that's developed. And then we're going to show you what happens when you actually bend your ankle back. This is the position your ankle's in when you bend it back. And that space narrows, and that talus bone hits that spur and goes clunk, right? And that's what causes the pain and reduces your movement. Now, to give you guys a better look at what everything actually looks like, we're going to draw that diagram again with the spur, but we're actually going to show you an x-ray this time to show you what it looks like on an x-ray. So this patient had a spur, and we're just going to label it for you just there. It's that, that protruding thing at the front just there, right? So that's what it looks like in terms of an x-ray, but it can sometimes be just tissue that we pick up on an MRI as well. In regards to treatment, you can inject it with steroid or a local anesthetic around the spurs, but most of the time we've got to do what's called an ankle arthroscopy with 2 little cuts, as in the picture there, and we use a little burr to actually remove them, and usually back to work or sport within 3 or 4 weeks afterwards. It's a pretty good operation. Now, the third problem that it can cause ankle pain is pain on the little toe side of the ankle, and that's usually due to the peroneal tendons, which are those tendons there that run around the little toe side of the ankle. They're called peroneal tendon tears or tendonitis, which causes the pain. It's usually after an ankle sprain, but it can also be due to the shape of the foot. If patients have heels that point inwards, then that can really cause them pain. Now, the position that you get yourself into to do an ankle sprain is an inversion position where the foot rolls in, and that's all loading up on that outside of the ankle there, is masked by the arrow. And you may notice that there's some isolated swelling behind the knuckle or the lateral malleolus, the little toe side of the ankle. Your ankle, it can be associated with ankle instability, and the pain is usually worse when you roll the ankle in, but you might find that actually rolling the ankle out, as in the position on the picture there, is actually a bit weak because the tendon's not working as they should be. Now, in regards to treatment for this type of problem, usually the first line treatment is physiotherapy. That's to usually get the tendons gliding and to strengthen the outer aspect of the ankle to stop you from spraining the ankle again. Local anaesthetic and steroid injections can also help in some instances. In surgery, if those other things don't work, usually means exploring the tendons and repairing them if you find a tear. The fourth most common problem that you'll find for ankle pain is pain at the back of the ankle, and this one actually relates more to the heel than the ankle. So this is a diagram of your Achilles tendon attaching down to your heel, which is called the calcaneus. And so the diagnosis is Achilles tendonitis. There are actually two types. One's called a non-insertional Achilles tendonitis, and the other one's called an insertional Achilles tendonitis. Now, just to mark where those pains will be, if you have a non-insertional tendonitis, it'll be where the top arrow is, and if you have an insertional tendonitis, it will be the bottom arrow is just there. Okay, those were the two locations of pain will be. Now, just give you to reiterate that once again, we're sort of going to mark that out with a colouring. So for an insertional tendonitis, it's going to be painful in that little pink area there at the base of the heel where the tendon inserts into that area. And for a non-insertional Achilles tendonitis, it's going to be in the mid-subs of the tendon, which is in that yellow area just there. Okay, so hopefully that gives you a better idea where your pain potentially will be. Now, in terms of the percentages of what you get when you get an Achilles tendonitis, if you have about 60 to 65% of presentations with Achilles tendinopathy will be of the non-insertional type, whereas only 35% will be of the insertional type. And the first line treatment is generally physiotherapy, but each of these conditions responds differently to that. So a non-insertional tendinopathy, 85 to 95% will respond and get better, whereas an insertional Achilles tendinopathy, about less than 30% will respond to physiotherapy. And that means that an insertional Achilles tendinopathy, more often than not, ends up with an operation. Not in everyone, but it's a bit more common than in the other type. Now, other treatments that can be tried for these conditions are things like heel wedges, where you actually raise the heel up, take a bit of tension off the Achilles. The other thing is a local anaesthetic and steroid injection adjacent to the tendon, not within it. And then the third thing is surgery, where you actually take the tendon off and remove the inflamed tendinal bone, and that's for the insertional Achilles tendonitis. Now, this picture here is just an example of your insertional Achilles tendonitis. They often have something called a Haglund's deformity, which is a little bony protrusion, which is marked by the red arrow just there, and the yellow bit there is the Achilles tendon itself attaching into the heel bone. Now, we're going to go through a few sort of diagrams here to sort of help you understand what we do for the surgery. So this here is the Achilles tendon from the back in yellow, and the white box is the calcaneus or heel bone. And what we do in the surgery is actually peel the tendon off the base of the heel bone so we can get access to that extra protrusion of bone to take it off. It also gives us access to the back of the tendon so we can take away any scarred or inflamed tissue. So this is it here. We actually take off the inflamed bit of tendon that exposes that bony protrusion bit, which is marked by the red arrow, and just that line there marks what area of the bony protrusion we have to take off in order so we can, to have a smooth area for the tendon to reattach to. So in this photo here, we've taken most of it off with the tendon still off the bone. And then what we go and do once we've taken that bony area off is we reattach the tendon. And then we slowly rehabilitate patients from there. Now, last but not least is ankle arthritis. It can certainly be a cause of pain, and it can be cause of pain anywhere around the ankle depending on which area is involved. That's a picture of it there where the joint space is narrowed. And we're about to explain to you what ankle arthritis basically means, but often it's worse on uneven ground. Patients often complain of the pain being worse in the morning, sometimes it keeps them awake at night, and the joint is obviously a bit stiffer because it doesn't move as easily as what it did before. Now, and to explain what arthritis means, joints have a nice smooth cartilage covering called cartilage, which is smooth, and the cartilage has very little friction, so it allows the joint to glide nice and easily. Underneath the cartilage is bone, and bone is good and solid, but bone is also rough. Okay, it's not like the cartilage, and actually it's a little bit like sandpaper when it's exposed, and it has a lot of friction, so it's not made for moving joints, right? What happens in arthritis is that cartilage wears away for whatever reason, right? And unfortunately what that means is that the rough bone is then exposed, and that can then take off any remaining cartilage like sandpaper. And it rubs off more and more cartilage, exposing more and more bone. And so eventually, unfortunately, you can see where this is going, it means that there's more bone left rather than cartilage. and eventually you get bone that's rubbing on bone, sandpaper rubbing on sandpaper essentially, right? And what this means is that this causes pain, causes clicking, causes inflammation and reduced movement. And you get something like this where the black stuff is the cartilage and the red stuff is exposed bone. You get bone rubbing on bone and things just don't move easily. So the treatments for this are things like braces, injections, certain medications like anti-inflammatories if you don't have contraindications of this. And the surgery is usually ankle fusion versus ankle replacement, which is a controversial topic. Ankle replacements haven't done that well in Australia, but that's something to discuss in a different talk. But thanks for listening today. Hope you had this was very useful, and as always, tune into www.hunterfootandankle.com.au to check out more information. Thanks.